Okay, I think we'll go ahead and get started here. So welcome everyone. My name is Greg Smith. I'm Executive Director of the Florida Literacy Coalition, and I'm joined today by Heather Surrency, who is our Health and Financial Literacy Coordinator and manages our Health Literacy Initiative. We appreciate you joining us today to learn a little bit about a grant opportunity that we currently have. That's offered through the generous support of Florida Blue and the Florida Blue Foundation. They've been supporting this initiative since 2009. And so we're excited to tell you a little bit more about it today. I know some of you may be familiar with the initiative and others aren't. So we're going to kind of make sure that we cover all the basics here this morning, including talking with you a little bit about health literacy. So if you can go ahead and Heather and advance the next slide. So we want to start with this. This is sort of an interesting statistic from the National Patient Safety Foundation that really makes the case that, or makes the claim that literacy really is the most important, or certainly none of these other factors, employment, education level, racial, ethnic group, affect health status more than literacy skills. Next slide. So when we're talking about health literacy, this is the definition that we typically use. Health literacy is defined as the degree to which individuals have the capacity to obtain and process and understand basic health information and services needed to make appropriate health decisions. And the concept behind this whole initiative and these grants is to infuse health education into adult education, literacy, and ESL instruction. So as folks are developing English language and literacy skills, are also gaining information that's useful to them, hopefully making good decisions when it comes to their health and nutrition and that of their families, as well as accessing health services. And so we talk about sort of health delivery systems and what are the differences between, doctors and urgent care, emergency rooms, and of course, insurance, how to pay for it, so forth. So if you look at health literacy, it's sometimes helpful to kind of think of it in terms of sort of the different settings, or the clinical, navigating the health system, and then sort of living a healthy lifestyle and sort of preventative health. Next slide. So this data is somewhat old, unfortunately. We don't have anything more recent than 2003, but back when the NAL, National Assessment of Adult Literacy, included a health component to it. And frankly, the newer PAC data reflects a lot of the same literacy statistics. So I would assume that a lot of this still applies in terms of the health literacy side, but just to give you some context, and they kind of looked at the correlation between having low health literacy and low literacy skills, and they found a very strong correlation. And so on the health literacy side, just to give you some context, we are typically working in our programs with individuals who would probably fall in sort of the basic and below basic levels. And so for those 14% of the population that's the general population that have below basic health literacy, they could struggle with things as simple as circling the data on a medical appointment form, and sort of those that are at the basic level, being able to read a pamphlet and find a couple pieces of information, with regard to whatever, health disease or condition that they're reading about. So it's a pretty significant segment of the population. And when you look at who we tend to serve in adult education and literacy, next slide, there's even a stronger correlation. So you look at these categories, I think you'd probably see a lot of our students would fit within this. Certainly individuals who did not graduate from high school or who have limited English skills. And so you can see, for example, not graduating from high school, that over half of the population has below basic health literacy. Next slide. So what does that mean? Well, there's a lot of data out there, a lot of statistics, but we pulled a few items here that if you have poor health literacy, you're more likely to have chronic diseases. Populations that have poor health literacy are also less likely to get the care that they need, or are an average of 3 times or have 3 times more prescriptions filled as adults than adults with higher literacy skills, and are twice as likely to be hospitalized, as well as unfortunately have shorter life expectancy. Next slide. So just to share with you a little bit about this initiative, which started back in 2009. So through the support of Florida Blue, we've been able to do this ever since. We typically offer about 14, 15 grants a year. They're $5,000 up to $5,000. As I mentioned, this really is to provide some resources to integrate health into your adult education classroom or tutoring experience. We've awarded grants to more than 60 organizations, and this is a grant that folks can and do reapply for. And a number of our grant recipients have received multiple grants over the years. We've now served collectively with our local partner grant recipients over 23,000 students and formed over 300 community partnerships. And partnerships are a key, as we're going to discuss here a little bit later, to the success of this initiative. So the phenomenal work that our grantee partners have done, I mean, really, I'm always continually surprised and delighted by the great work that they're doing that's really making a difference locally. And our grant recipients, just to give you a sense, next slide, really represented different kinds of organizations. Some of them are school district-based, state colleges, library and nonprofit literacy organizations. Here are our grant recipients from this last year, 21-22. Next slide. Well, our numbers are a bit down, as they are throughout adult education in terms of students served during COVID. We still saw good results last year, and the good work is reflected here. About 75% of students improved their health literacy with an 18% average increase. Teachers report that their students are better prepared to answer questions or ask questions of their doctors, and we do a survey. So we basically have 2 sort of data points, data sets that we use sort of to measure the success. One is a pre and post health literacy assessment that we ask programs to do, and the other is a survey. And so from the survey, we do ask for feedback in terms of whether what students have learned have helped them, and if so, in what ways. And we're seeing that and this has been pretty consistent over the years, that students exercise more. Once they learn more about the benefits of exercising, eating healthier, they have, the better capacity to read medicine labels and communicate with medical practitioners. And this is just a sampling, but the impact is pretty significant, we feel, certainly given the investment. Next slide. Oh, okay. And with that, I'll turn it over to Heather. And I know, Heather, we had a couple of folks who are returning program people that we might ask to say a few words as well, right?
Yeah.
Heather?
Thanks, Greg, and good morning, everyone. I went back to this slide because I know we've got 2 pictures here of actual programs and work, and I think both of these grantees are on the call who have these programs. So if anyone who's had the grant before wants to speak, maybe Kathy, just kind of a little bit about the types of impacts that your students have experienced as a result, or a little bit about the programs that you do. We just want to give those of you who are new to the initiative kind of an idea of the wide range of effective programming that's being done.
Yeah, I'll be happy to speak. Hi, everyone. I am Kathy Severson from the School District of DeSoto County in Arcadia. We have been the fortunate recipient of this grant for several years now, and we have seen firsthand how it is changing the lives of many of our students. We're a small, rural, low socioeconomic community, and much of what we're getting into the hands and minds and thoughts of our students, they might not otherwise receive. So we feel really blessed to have been a part of this great initiative. Actually, the top picture that you see on the screen, that is our 100-mile walk. It is a school-wide initiative, not just our ESOL and family literacy classes that participate specifically in the health literacy initiative, but every day around 10 o'clock, those that are interested will take about a 10 or 15-minute break and walk around the building. And these are obviously two of our their employees, but behind them are a couple of students rounding the corner. So that's just an easy way to get people out and moving. We have done healthy gardens with our family literacy little guys, our pre-K students participating along with their mothers. We have guest speakers coming in as far as pharmacists, diabetic educators, doctors, the health department. We have a really great relationship with our local health department. So it's been a great project for us to be a part of, and I would encourage anyone to consider applying for it.
Thanks, Kathy. Sorry, I have a meowing kitty, so I keep muting myself. Any other grantees just want to say a few words about the types of programs? Joe, if you'd like to go ahead, that'd be
Yes,
great.
thank you. Yes, this is really, as Kathy just said, this is a program that really works, and I want to thank the Literacy Coalition for this, because we've had a lot of success over several years of being grant recipients, so thank you very much. And in addition to what she was talking about, we've also had CPR classes. We have one scheduled in February for our class also. And we use here in St. Augustine, St. Johns County, we use the Wildflower Clinic, which is for people that are in that no man's land of no health insurance, no Medicaid. So they kind of depend upon a lot of volunteer doctors and nurses to help them, dentists to help them. And we have them come in and speak to a lot of our students and let them know how they can avail themselves of that. And we've also done some visits to the Publix pharmacy and gotten some information from the Publix as far as the WIC program, food stamps, and so forth. And I don't know if you mentioned it prior to me getting on, and I'm sure Kathy agrees, your Staying Healthy for Beginners and your books, they're like Bibles as far as I'm concerned. All the students love them. They're great in terms of what the recommendations they give, the vocabulary increase that they give to people. So without belaboring it, this is a great grant. I definitely encourage everybody to apply for it because it's more than useful. Thank you.
Great. Thanks, Joe. So I'll continue on and tell you a little bit more about the grant program and some of the activities. And then at the end, if you have any questions, obviously for us or even for the grantees, we can talk a little bit more about the specifics at that time. So I just wanted to kind of touch on our approach that we use in the Florida Health Literacy Initiative. We really look at this in terms of contextualized instruction. So it's really a win-win situation for our students because we're infusing health literacy into an adult education or ESOL curriculum, which in addition to increasing understanding of health information, advocacy, and all these different health-related topics, we're also building English language skills, literacy skills, conversation skills. Numeracy is a big part of understanding health information, whether it's risk factors or percentages or understanding deductibles and copays on a health insurance policy. Digital literacy is another big component, and we are always expanding our offerings in this area. For instance, we just released last fall a new online program for students to improve their basic digital health literacy skills and learn how to find information on the internet. And then also just confidence. We're going to talk about projects, but being able to practice these conversations or design projects that then they might do a presentation for other students or develop a material really can build confidence for our students. Another area I think Joe just mentioned was CPR certification. another great area to build confidence. So if a student receives a certification, that might be one of the first times they've gotten something like that, and really can give a great sense of achievement and helping them further their education. And then really also helping with retention. We do ask questions about that, and pretty much all of our grantees report that students are excited to come to their health literacy classes. They're pretty engaged, and that it most likely is positively affecting retention. So this slide kind of also reinforces that, and I have pictures sprinkled all through, and these are actual pictures from our grantees and the different projects that they do. You can see CPR is one in the middle, and that's definitely been a popular class for many of our grantees to offer. Some have community partners come in and do the CPR classes, and then some programs actually get instructors certified, staff certified as instructors, and that can be done under our grant funding as well. And then on the right, you can see a community garden, which is another very common project. But family health is really a motivating factor for a lot of students. And so that can motivate their learning to acquire more literacy skills and language skills. So promising practices and partnerships are the next two areas that I wanted to talk about. One of the components, as Greg mentioned, of this grant program are project-based learning activities. And then also community partnerships are really key to this as well. We do not expect adult education or ESOL instructors to be experts in the area of health. There are so many community partners probably that maybe you already work with or have worked with in the past that would love to partner and help bring some of this more technical information to your students. But we do have the Staying Healthy curriculum, which I'll talk about in just a moment. A lot of the information we convey is just basic health information, general guidelines that apply to everyone. So speaking of that curriculum, if you are an adult education or ESOL program in the state of Florida, you already can receive free copies of this curriculum. You just need to request them. We can provide a limited number to any organization that requests them through a grant that we have with the Florida Department of Education. So we have a number of titles under our initiative. We have our Staying Healthy curriculum, and actually I'll see if I can get this to work. I'll go ahead and look on our website where you can access these. They are all freely downloadable. But then also on this page, and I'll show you how to navigate here, but it's basically just going to floridaliteracy.org and then going to our curriculum. We have Staying Healthy for Beginners, which is designed for a low to intermediate student. It is written at approximately a 3rd grade level and is kind of in a workbook type of format. For intermediate students, we have the blue cover, which we just call the Staying Healthy or Staying Healthy Intermediate. We also have a Coping with Stress curriculum, a women's health curriculum, and I don't see the careers on here, but we also have a careers in health curriculum as well. So a lot of different types of resources that are available to you. And if you are a grantee, you can request even more copies to make sure that each one of your students is able to have their own. All right, just a moment, sorry. So also for those who are grantees, we have quarterly networking conference calls. So we meet together and we talk about different ideas. With COVID-19, for instance, we did a lot of brainstorming and strategically kind of looking for classroom resources, curriculums. Our staff also puts together materials on different topics like diabetes, stress management. So we really want to make it as easy for you and your instructors as possible. So we kind of provide these are ready to use resources that teachers can just use with students. We also have the Florida Literacy Conference and other professional development opportunities available as well. So really, Greg and I and the staff at FLC are here to support people, whether they have taught health literacy before or whether you're embarking on a new program. We have a lot of resources to support you to do that. Another piece, though, of the networking conference call I didn't mention is ideas from each other. It's great, kind of as we have gone through this process, we've been seeing more and more grantees supporting each other, even outside of kind of these calls, providing ideas, providing trainings. So it's really great to have other peers in the field who are also doing some of the similar work that you might be doing. So we will be awarding 14 mini grants, as Greg said, of up to $5,000 each. We do have a few requirements. You must be a 501c3 nonprofit organization or a government-based agency that provides adult ESOL, adult literacy, and/or family literacy instruction in Florida. So the focus of this grant program is towards adult learners. You must also provide literacy services via classes, small groups, or one-on-one tutoring. So we're really flexible kind of in how you do that. I would say the most of our grantees get via small groups. We do have a few on-one as well. And then those groups will often, or those students will often do a project with other students who are also receiving one-to-one tutoring. We also ask that you commit to basic reporting requirements, which I'll review in just a moment. So the application materials are posted on our website, which again is www.floridaliteracy.org. There you can find the online application. We also have guidelines, a checklist of all the materials that you need, and a frequently asked questions page as well. And all materials must be submitted electronically. So I am going to go ahead and click on that so you can kind of get a sense of what it looks like. So this is our website. If you click on health literacy, and it will take you to this page, which has a menu at the top. And if you go into grant program, that's where the application is housed. So again, we have these guidelines. We have an online application template. We ask that you fill out. Give me a moment, see if I can get that to come up. We do ask that you fill out all sections. You can change the format a bit, but we need all of the headings to be part of that application. Sorry, it doesn't look like it's coming up for me. Here we go. And it does have the address on this application of where you're going to upload it onto SurveyMonkey. So the first part is a narrative, and I'll talk about this in more detail in just a moment. I just wanted you to kind of see what it looks like, the project description, and several other different headings, and then the budget. So that should all be explained pretty well in that application. So these are the headings: the abstract, history and accomplishments of your organization, a needs statement, specific measurable objectives, at least 3 we prefer. Measurable meaning, saying exactly what you're going to do, how you're going to do it, and then how you will know if you're successful. For instance, it could be we will do 20 hours of health literacy programming with 50 students, would be an example of a measurable objective. We want you to go into some detail on your project description and try to be as detailed as possible with about this. We don't expect that you have perhaps your entire program mapped out. Oftentimes, we may come up with topics based on student needs. We may develop student projects based on student interest and needs, and we totally understand that. But we want to be really specific so that our selection committee understands kind of, what your purpose is, what your objectives are, and what you want to achieve. We want you to list who you plan to collaborate or partner with in the grant program, how you will provide recognition to Florida Blue. So will you maybe put some information about the grant on your website, or will you release a press release, things like that, because we definitely want Florida Blue Foundation to receive recognition for all of the great support that they have offered our health literacy program. A timeline of about when you're going to implement each of your different goals, and then a little bit about evaluation. So also is a budget is required. We provide you with this template worksheet. You don't have to use this, but we recommend that you consider it if it fits your guidelines. And you want to make sure that you do explain exactly how you are going to use the grant money that is coming from this grant. So if you have other income sources, that's fantastic, and you can include those under the revenue section, but please be very specific though about how this $5,000 will be spent. And these project expenses should be outlined in this budget, and make sure that your project expenses directly relate back to your objectives. Oftentimes our selection committee is looking at that. So if they see that you're going to spend $1,000 on a particular program, they need to be able to refer back to the description and see exactly what it is that you are talking about. Also, other expenses, salaries, benefits should be listed here, and then any other in-kind resources such as volunteers or office space can be listed there as well. We don't require that there is additional revenue support, and we don't require that there are in-kind resources either. We just kind of ask for that information so that for people that do have various sources, we can get a good understanding of what your program looks like. So this graphic on the right shows you kind of what that Survey Monkey upload page looks like. We do ask for a number of demographic kind of applicant questions for you to fill out. And please indicate if you are a grant person who will not be working directly on the program. Please make sure that you include the contact name of the person who will be implementing the program. We've had a few times in which we've been unable to reach that project director because we don't have the name. So that's really helpful information for us. You're going to upload the project proposal, the proposal narrative and the budget, which has a 5-page limit. And then you can also include some supporting documents if you would like, newsletters, articles, letters of support, anything that you feel would, again, help the selection committee understand a little bit about your organization or the project. Just make sure that it is no more than 2 pages. We will automatically cut off any attachments at the 2nd page. So I would prefer that you just upload those 2 pages only and not, for instance, a whole newsletter that's 10 pages. All documents that you upload must be PDF files. That is the best type that we can use. If you try to upload Word documents or other documents, the formatting may change, and it might be difficult for the selection committee to read and assess your proposal. So the reporting requirements for this grant program, we do provide you with the pre and post student assessment. It can either be given online or it can be given on paper and pencil. And that again is provided to you. Greg mentioned the student survey. At the end of a semester or the end of a class, we do ask that you also administer this survey, and it asks questions kind of particular to behavior during the grant period. So did a student change their eating habits or exercise behavior? Did they sign up for a new health insurance policy? Did they access new health websites on the internet as a result of learning about them in class, things like that. We also asked for a teacher survey just to give us some feedback on how we can better support you and your opinions of the different materials that we offer. There's a brief mid-year report that needs to be submitted, as well as an end of the year report that just details all of your activities. We take all the individual end of the year reports, compile them together, and that's our final report to Florida Blue so that we can continue requesting funding from them. And one thing I wanted to go back and go into just a little bit more. I didn't really talk too much about the project-based learning activities, and so I'm going to click on our website, hopefully. Because on our website, we have some great ideas and suggestions of projects that you may want to do with your students. So if you go to the student project site, again, if it's under the grants program, you can see we have a student project tab. We have some videos that we have put together in prior years that kind of compile and detail all of the different things that the grantees have done. We ask grantees to send us as many videos and photos as they can in order to kind of tell the story of our initiative each year. So I encourage you to take a few moments to watch these videos. And then we have, again, a lot of different examples. I mentioned community gardens, so it tells you a little bit more specifically about different organizations that did that and how they did it, the CPR classes. Miami-Dade College has access to a laboratory, so they do all sorts of really interesting projects with experiments in the lab. And that's another really good point. Like many organizations, look and see what are the strengths, what are the resources that they have, and kind of leverage those for their students. So not everybody has maybe this kind of resource available on their campus, but maybe at your school or in your community, you have a different type of resource. We worked with an organization here in Orlando with us And they had a great relationship, for example, with the University of Central Florida Medical School. So they were able to offer a lot of different services and meeting with med students and things like that. That was a great resource for them. So we really tried to encourage you to leverage the resources that you might already have. Field trips are another really useful project that a lot of people do. Many people take trips to Publix, for example, to learn about healthy nutrition and meal planning. Down here, we heard from Joe. This is his group going to a farm and learning more about organic gardening and vegetables. Contests, like we talked about, students love, trying to achieve a goal, whether it's a certain number of steps or a certain number of times working out. It's another great idea. Health fairs, recipe books. Several programs do have chefs come in and teach about healthy recipes. Some programs take kind of traditional recipes from different cultures around the world and try to make them a little healthier, which is another really fun project. Posters and presentations, videos. So I really encourage you to look at this page to see all the different types of activities that we do. Because again, we know with project-based learning, if students are able to take the information they learn in class, and then they're able to produce some sort of material that can help others, it has so many benefits in terms of improving their confidence, but also, you then have materials that can be really useful to other people in your program. Another common thing that people have done is coming up with resource sheets, maybe free clinics or healthcare providers in the area that may provide reduced or low cost services. That would be another great way for students to first learn more about health resources in the neighborhood, in your community or neighborhood, and then also be able to convey that to others. So many great projects that students can participate in. And then I mentioned the community partnerships, definitely important, as I was just saying, for those projects. But if you take a look on our website, you can see just the wide variety of partnerships that have been developed throughout the history of this initiative. Anywhere from working with poison control. There was a program that had some issues with water safety and water hygiene. So they worked with their local departments on testing water for safety. So there's just so many different ways that you can support the people in your community and their needs. Greg, anything you want to add to that?
On the projects? No, I don't have anything on the projects other than the fact that I'm always impressed by the range of partners, I should say, that the grant recipients work with. And I think even if that's not clearly articulated in the grant, we know that sometimes those projects, those partners might not be in place, but I do think that when the grant recipients come together and they share information about who they're working with, that really generates some ideas, as well as the website here. So don't feel that you have to have all your partners in place. And I also wanted to mention on the evaluation piece, I know there's an evaluation component in there. And we have that in there because people do want to sometimes elaborate on what they're going to be doing on the evaluation, especially if it has something specific to do with a component of their project. But really the core evaluation tools, as we mentioned, are the pre and post health literacy assessments and then the survey. So if that's really, those are the two pieces you want to use for your evaluation. In fact, that's sort of a required piece, but if you just want to articulate that you're using those two, that's absolutely fine. So, and it looks like Heather brought up the reporting documents here. We have our pre and post assessment and our student survey, and we don't really anticipate that we're going to be modifying that very much. So if you take a look at what we have here, you'll get a sense of what those tools look like. And I don't know if you have anything you want to add to that, Heather.
Yeah, that's correct. And so as I mentioned earlier with our Staying Healthy curriculum, we do have a beginner Staying Healthy curriculum and then an intermediate. And so you can see here, we have assessments that go along with the different curriculums, and we do have them in English, Spanish, and Haitian Creole at this point. So you're welcome to click on those and take a look at what the questions are. So that's about all I have. We would love to hear your questions. If anyone has questions about eligibility or the types of programming that we do. And then also if there's any grantees that want to share anything at this time. I think we have about 10 more minutes.
Okay, so let's open it up. If you can either unmute yourself or add a question to the chat. Folks have any questions?
I do. My name is Beth Nightingale. I'm a contract grant writer. Can you hear me clearly?
Yes. Yeah,
Okay.
we can, Beth.
Thank you. Thank you. This is a great program. I have just a few questions about the reporting and the application. Do you have an estimate of the time that one would be expected to invest in the application and or the mid-year and end-year reporting? Do you have a gauge of the number of hours that would be expected to generate a solid application and or reporting? That's my first question. And then my second question is, and I did join just a couple of minutes late, so if you addressed this before, I apologize. Do you know how many applicants you've had in the past years compared to those that were awarded?
Well, on the first question, and there may be some folks who've applied that would have a better insight into in terms of how long it takes. It's a 5-page application, so it's not, a huge time commitment. If you look at the areas, that we're asking questions about, a lot of them will reflect sort of your ongoing programming, I think, in terms of your history and so forth. But yes, I mean, there is some time that needs to be needs to go into thinking through and articulating what you want to do. I think one advantage to this initiative is that we have a lot of good resources on our website, as Heather just outlined, that provides some solid ideas in terms of what other programs have done. We have the great advantage of this being around for a while. So I don't know if there's any grant recipients that would like to chime in on how long it typically takes. Obviously, if it's a first-year application, it'll take longer than if you're reapplying, where you can kind of pull from your previous applications. I think most of the folks who reapply do that. Is there anybody that would venture to share a little information on how long it typically took you to apply for this grant?
I mean, I think that your last point was definitely well taken. If it's your first time around, it might take you a bit longer than if you've done this before, because you haven't compiled that information and you don't have it readily available. I mean, I don't know, 10 to 15 hours probably in terms of getting everything together and doing it and reviewing it and so forth. For the initial application, I don't think that that's unreasonable.
Yeah. And in terms of the, thanks, Joe. And in terms of the percentage of programs that are funded, Heather, do you recall, do you have some data on that? It's a fairly high percentage, I think, isn't it?
It is, and it really kind of depends on the year. So some
Right.
years we have a lot of applications. I will say probably since COVID-19 has been affecting programs, we've had fewer applicants just because some schools are a little hesitant if they can't predict what their next year is going to look like. But I feel like probably this year we'll be back up. It's probably about half or even a little bit higher than half of the applications are funded in general, I would say.
Yeah. Yeah, I would say a third to a half is a good, so it's pretty good. If you got a 1 in 3 or 1 in 2 chance, I mean, you can't really look at it that way. Obviously, it's the quality of the applications that really drive it, but it's, I'm glad that we're able to fund a good percentage of the applicants that are the programs that apply.
And I will say, we do sometimes have applicants that don't fit our eligibility requirement. And so those applicants don't go before the selection committee. So that sometimes can change percentages as well. And in terms of eligibility, meaning that they are providing services, that they're not a for-profit company. And then some people just don't submit the required documents as well. So the only thing that is forwarded to the selection committee are the applications that fit, all of our criteria and requirements. The other question you had was about the assessments, and I think different schools will give you, or different programs will give you different information about the assessments. They can be a little bit challenging sometimes because some of our adult learners maybe don't have as much experience with assessments, but we do feel like it's actually a skill that they need to learn. And so for, I would say, the school districts, it's probably a little bit easier to do these assessments because it's already part of their normal curriculum. And for some of the community-based organizations, the first few times it might take a little bit longer to administer the assessments, but it's not an overwhelming, I don't believe, time commitment to do that.
Thank you.
In terms of advice, and this again speaks to your chances of getting funded, we do get applications sometimes that just don't follow the rules and guidelines. So
Right.
just keep track of that. Don't make it a, it's a 5-page limit. Don't submit 6 or 7. Make sure you cover all the categories, things of that nature. I do want to say one thing in terms of how the money's spent. We're pleased that we're pretty flexible on these funds. I know some funding sources may be really restrictive in terms of how dollars are used, but these dollars are pretty, it has to go to the core of what the program's about, but they can be used for field trips and, food if necessary. And, sometimes folks will use them to, fund things like first aid kits or pedometers for their students, things of that nature. So there's a good amount of flexibility there. We just would ask you to, if you articulate in the budget, that it ties back to something that you've written in the narrative. Other questions?
Hi, Greg. This is Karen Strange. I do have a question kind of related to what you were just talking about with the food thing. We were, Chris and I were just talking ourselves before this meeting, and one of the ideas we had come up with for applying for the next go round is including more lunch and learn type activities, and we thought using some of the grant money to actually provide food and healthy food. It would be the plan from different, would that be something? I mean, that would be, we're thinking maybe a couple of lunch and learn. So we're just talking about, so I don't have exact numbers, but is that something that you think would be acceptable in the grant application?
Yeah, I don't think that would be a problem. I think the only thing Heather, add to this if you feel there's something I'm missing, but I do know that sometimes the grant committee, it's an independent grant committee, if it looks like it's sort of out of whack. So we have had a few applications where it's like been, a couple $1,000s out of a $5,000 grant is for food, and that kind of, raises some questions. So as long as it seems like it's sort of proportional, and certainly a few lunch and learn kinds of things, sound like that would be well within what would be just fine with the grant review committee.
Thanks.
I would agree. And then also some grantees, as I mentioned, like the Publix field trip. So maybe they will have money to purchase a healthy meal, or I know Literacy Council of Sarasota, like if they do successfully develop a healthy meal plan within a certain financial level, I can't remember if you're on there, Tom, it's like they can do a healthy meal for less than $20 and they get a gift certificate kind of as their end of the project motivator. So we also encourage things like that if there's a direct tie again. So for Literacy Council Sarasota, they partner with the food bank that have a nutritionist or dietitian that can accompany their students to Publix. I know others just do a Publix tour where they might meet with the pharmacist, or, there's so many places, drugstores, things like that are useful, and there can be some money given to those people in order to do projects.
Yeah.
And I did not mention there is a limit of $1,000 for computer equipment purchase. So make sure you read those guidelines carefully in terms of what the limits are in expenditures.
Other questions?
I have one other question. To what extent does the size of the audience of the nonprofit matter? If it's a small nonprofit that serves, let's say, 100 individuals, is that still, if it's a really well-written
Sure.
Okay,
I don't think that would be a problem. Yeah. That should be
We have
fine. There-
programs that serve less than that. It really just depends on your size.
Right. And sometimes we get a question in terms of sort of the how many hours, instructional hours. Could you speak a little bit to that, Heather? We do sort of have some averages in terms of, what the intensity of instruction is. Because one of the great advantages to this approach is that since it's integrated into existing adult education classes and tutoring, that they get, more health content than they would get if they were just sort of doing a community workshop. So in order to work through the sort of the curriculum, and the curriculum is not required, but just about all the programs that do use staying healthy to some extent, and usually it's sort of the core curriculum. But Heather, can you speak a little bit to sort of on average how much time they'll spend?
So different programs do it different ways, but I would say on average, most of our grantees are dedicating about 20 hours to health literacy, but that also includes project time. So if they're working
Right.
on a student-based project, then that's going to take a good amount of time as well. Some programs do health literacy instruction throughout the whole year. Some may do a semester where they focus on it. Some may even compress it into a shorter time frame. So we're not specific in terms of that. I mean, obviously, you need to develop a program that best meets your students' goals and the way that your institution runs. But on average, I would say 20 hours is about a good number. I don't know if any grantees want to chime in on that, but that's pretty much what I see. We are not looking to fund programs that are going to do a 2-hour workshop on health literacy. As Greg said, really to get into some of these skills, to take a contextualized instructional approach, it just needs more time. Many of these learners have not seen this information before, and they need reinforcement, they need activities, they need classroom interaction and conversations to really gain the skills required to have basic health literacy.
And while we don't have any sort of defined time frame, most of the programs do use a good portion of the year, 9 to 12 months. So that's really sort of a competitive element too. So if you're looking at two comparable applications and one's only doing a two or 3 month program and the other's doing a 9-month program, that's obviously a factor. But this is really for you to kind of develop what's the best fit for your program.
So we have a few questions in the chat. So I can be your support. So if you have questions about the application process, if you have questions about, is this a good idea? Would this fit within the guidelines? Feel free to reach out to me. Email is the best way to get a hold of me. I'd be happy to help you however I can. And an organization does not need to be a member of FLC to apply. We really encourage everyone to be a member, however, but it is not a criteria.
Okay, very good. Any other questions before we wrap this up? Okay, well, very good. Well, thank you, Heather, and thanks to all of you for participating today. We do hope that you'll strongly consider applying, and thank you for all of our current grant recipients who chimed in as well, and for doing so and for all your good work. So let us know if you have any additional questions, and otherwise you all have a great afternoon. Thank you.
Thank you.
Thanks.